Welcome to Prep and Play, where we have conversations about safer sexual pleasure. This podcast is dedicated to empowering listeners through open, honest discussions surrounding keeping our minds, bodies, and spirits healthy while being sexually active.
My name is Danielle, and I'm the Rural Outreach Specialist at AIDS Alabama South. And today I have with me Alftan.
So thanks, Danielle. I'm so happy to be here with you. So as you've said, I'm Dr. Alftan Dyson. I'm a pharmacist by training and have been for quite some time, living in the Montgomery area and practiced there for most of my time. And then joined ViiV Healthcare in it's been a while, in 2019. Joined the company there, have worked a multitude of roles, but currently now serve as our head of strategic medical partnerships in North America Medical Affairs.
Awesome. And so today we're going to be talking about one of the most powerful tools that we have in HIV prevention, which is PrEP, or pre-exposure prophylaxis. We're going to trace its roots in the early days of antiretrovirals to the latest innovations in injectable PrEP. And we'll get to hear from Alftan about how far we've come and what's still ahead. So, Alftan, can you tell us a little bit about your background and how you got into pharmacy and HIV care?
Yeah, so great question. So I actually was not going to go into HIV when I decided that I wanted to be a pharmacist. I was actually going to do clinical pediatric pharmacy. And actually, during one of my clinical rotations, back when I was in school, I rotated in a clinic that served people living with HIV at the time, and really just had a very life-changing experience and moment there, and recognized it as a opportunity to really make a difference and take care of communities that were oftentimes forgotten about or left behind, or seeing people who were disproportionately impacted by HIV and the impact that it had on their lives. And so really that experience changed my entire trajectory and drew me into the HIV prevention and treatment space. And so I've been doing that for the last 13 years. So just odd to say that. It feels odd to say that I've been doing it over a decade, but that's what drew me here, and really wanting to make a difference in communities that were disproportionately impacted, and being able to kind of be that voice and be someone that was there and available for them to lean on and have support.
That's awesome. So in your 13 years in HIV care, how have you witnessed treatment and prevention change over the course of your career?
So I would say in the course of my career, I've really seen us get to a place where antiretroviral therapy is, more tolerable, a little bit more easily accessible for some folks, but obviously there are still some challenges there. I think one of the best advances or things that I've seen that has been great is the introduction of long-acting treatment and prevention options for people. And I think that's been quite important as we recognize the need for choice for different people, because not everyone has the same needs, desires, and wants when it comes to their medications, either for treatment and prevention. And so I think seeing kind of these new modalities come into the market has been something that's been really amazing to watch over the last few years.
You mentioned antiretroviral therapy becoming more tolerable. And just for our listeners who may not know, what were the first antiretroviral treatments like?
Yeah, so the first ones could be quite challenging. And I think some of the biggest part of the challenge was how often you had to take the medication. So they were oral at the time, often taking multiple pills multiple times a day. And then the side effects were not something that were, most tolerable for most people. And so it really was a challenge for folks to be able to stay on medication, to be able to reach a place where they could, be managing the HIV virus in the way that we would need it to be managed. And so those kind of particular challenges really made it quite difficult in the early days in terms of, getting folks to an undetectable status when they're living with HIV.
And so how did that early landscape of medication shape the way we approach HIV prevention today?
Yeah, so the early days, I think, really taught us a lot about, one, needing medications that were tolerable, that people could take Obviously, in the treatment space, for sure, we knew that it would be for a long duration, but also in prevention, we knew that folks, it depends on their what's going on in their life at the moment, right? And so we knew that we needed options, choices for people that were tolerable, but were something that they wanted to take. And so again, going back to kind of that long acting piece, I think that really helped us shape what we see today, learning from the past and realizing that we needed those different choices and we needed different modes of modalities for that medication. I think another piece to that was around this adherence, but also stigma, right? And the stigma that is surrounding or kind of this halo over HIV just in general. And so with that, we knew that if we could bring in kind of long-acting medications, that may help us address some of these barriers, so that adherence barrier, but the stigma piece as well, because sometimes people don't want to take pills every day. That's just the reality. And sometimes that can be a challenge. And so what innovation could we bring to the market, I think was something that was driving a lot of the folks, and particularly driving folks at ViiV Healthcare to be able to bring something that worked for patients and hearing the patient voice and what they needed.
What role did pharmacists play in managing treatment during those early years?
Wow. So pharmacists, I think, had a huge role in the early years, and still currently, if I may be biased, but still currently in the HIV landscape. And so essentially, I think because, as I mentioned before, people were taking maybe multiple medications or multiple pills multiple times a day, there was a need to make sure that the importance of adherence and kind of really be the champions around sharing that information with patients and making sure that we could be that support system, those people to help them remember to be adherent to medication and the different timing of the medication. But there was also a need for managing drug-drug interactions. And so, thinking about pharmacists who are always seeing the different medications that people may be taking, all the concomitant medications, comorbidities, and that sort of thing. And so pharmacists really had a strong role in making sure that we were focused in, keyed in on helping to manage those drug-drug interactions and providing that support to the rest of the clinical team, be it the physicians, the nurses, providing that type of help and support to them as well as the patient.
And when did the concept of using HIV medication preventatively, like PrEP, first emerge?
So we've had PrEP for now over a decade, I think going on about 13 years at this point. And so that's kind of when we first saw the first approval of the first prevention medication coming to market. And it was oral medication at the time. We knew it was, one of our antiretroviral medications that we used in the space for treatment. And so obviously the science likely told us that we could hopefully use this medication for prevention as well. And it did come to market, as I said, in 2012, so about 13 years ago.
So that was around the beginning of your career, correct?
Yeah, yeah. I graduated pharmacy school in 2013, so came right as I was doing my rotations in 2012.
And so what was the reaction like in both the medical and communities when PrEP started to become available?
Absolutely. I think there's probably a multitude of reactions, right? There's excitement because this is new and it's exciting data and it's showing us something that to work and to prevent, HIV and prevent something that people for so long had been, afraid of and scared of, contracting HIV and not really having or knowing any other options outside of, condom use and things like that would prevent HIV. And so I think there was a lot of excitement around it. But I think also we have to acknowledge that in some communities, and particularly oftentimes communities that are disproportionately impacted by HIV, there's a little bit of skepticism as well, right? Because we have to think about kind of, the experience that has been had with the healthcare system and for some communities. And so that skepticism, and I always like to say a little bit of healthy skepticism, right? Because it's something new, and how can we be sure? So I think, the feelings were mixed, the emotions were mixed. So you have that excitement, and I think the medical community very excited because it gave us the opportunity to talk about and provide a different option to patients and provide something to them, this new biomedical intervention. But then also sometimes from community, this skepticism of does it really work and should I be taking something like this?
Yeah, definitely. We deal with a lot of medical skepticism even today. So, as a pharmacist, what would you say your role was in helping patients start and stay on PrEP in those very early years?
Yeah, I think starting out, the role would have been really around, making sure that folks understood the science, understood that we had the data to back up and support using this intervention, and that it wasn't, something to be afraid of, right? The healthy, as I said, healthy skepticism is okay, but let's have a conversation about it. Let's talk about it. Let's answer the questions, those burning questions that you have. And so I think that was a huge role for us as pharmacists to be there, have those types of conversations. Also raising awareness, right, about, PrEP as being an option. Because I think at that time, obviously, because it was new, there was a lack of awareness. But I think that still exists today too, right? And so there's a lot of need for pharmacists and other folks, community folks, all types of providers, making sure that people are aware of the options that are available to them. And so I think that was a huge role. And then obviously, in the earlier years, as I said before, this was an oral medication, and that's what we had at the time, recognizing that now we have long-acting medication, but at that time we had oral. And so needing to be adherent to the oral medication and taking your medication every day was something that was important, and pharmacists had a key role in making sure that people knew the importance of adherence and taking the medication every day for it to be effective.
And getting into some of those challenges of that daily oral PrEP, adherence is obviously a huge part of PrEP's effectiveness. So, what are some common reasons people would stop or miss doses of daily oral PrEP?
So I think it's multifactorial, right? So obviously there's the challenge with just adherence in general, and I think this is across the board for, most medications, and this idea of taking something every day and forgetting. I always ask people, do you take your vitamins every day? Right? Like sometimes you don't, you miss them. And so that's a huge kind of sometimes issue or place where there's the challenge with daily oral PrEP. Well, sometimes we forget other things that we're supposed to do every day. So it's not, uncommon that would happen here in this place with daily oral PrEP. I think, other barriers would be kind of going back to stigma. The idea of taking a medication every day, or the idea that someone could see my pill bottle, right, at home and mistake the fact that it is a medication that is used in treatment as well. So if somebody accidentally comes across your medication at home and now they've assumed perhaps that maybe you're living with HIV and not that it's for prevention. And so that type of thing would drive some people to shy away from or stop taking their medication. I think, some other common reasons would be people's lives change, right? So your circumstances today aren't your circumstances that you'll deal with tomorrow or a week from now or months from now. And so, people's idea of their need for PrEP can change over time. And I saw that quite often. People would be on it for a period of time, and then they would say, oh, I don't think I need this anymore, and would come off of PrEP. So, it can be multifactorial. Again, as I was saying before, that's why we need choices for people, because we're all different, right? And our reasoning and rationale for why we do things can be different. And that's the same with why we would stop taking medication. So it was a multitude of reasons and could be multifactorial for people.
Yeah, wow. It seems like you covered a lot of different factors there. And so, what are some strategies you've used, back when it was just the daily oral PrEP, when that was the only option? What are some strategies you would use to better support adherence among your patients?
Yeah, I would say setting alarm clocks. I tell people all the time, set an alarm clock to remind you to take medication. That was a big strategy that I think we use. Finding a support system, accountability partner. So someone that you were comfortable having that conversation with to let them know that you were taking PrEP and that you needed their support to remind you and keep you up to date, keep you on track with what you were supposed to be doing. So those were a lot of strategies. I would tell people sometimes sit the medication by your toothbrush, because hopefully we all brush our teeth every day, right? Or we all shower, we go into the bathroom at some point every day. And so that was another strategy. Put it next to something that you do, without a shadow of a doubt, you're going to do every day. And that way you have it, it's a reminder for you so that you don't forget. So those were, a lot of those strategies. I mean, and probably even some more extreme ones, maybe like calling people, regularly or every day, just saying, hey, just checking in on you, making sure you had your medication until they got in a routine and they didn't need that type of assistance anymore. But it depended. It depended on the person. I think what was key as a clinician at the time was making sure that I adapted and I adjusted to what the client, the patient in front of me needed.
And so now we know that daily oral PrEP is no longer our only option. So what is cabotegravir or Apretude, and how does injectable PrEP differ from daily oral PrEP?
Yeah, so Apretude or cabotegravir, long-acting, it's a PrEP medication, long-acting medication that actually received its breakthrough designation from the FDA in 2020. And it was really based on the data that we got out of the HP10 or HIV Prevention Trials Network 083 and 084 studies. Both of those studies were conducted and had large participation or participant numbers in those. And so because of the efficacy and safety results that came from those studies, the FDA decided to grant a priority review of the medication and then approved Apretude in 2021. And so it actually now has more than 24 countries where there's regulatory approval and availability of Apretude for people to use as an option for them for prevention. So I think, that's the nutshell about Apretude. The other thing I would say really about Apretude is the fact that not only do we have about 7,000 people in the clinical trials, or more than 7,000 people that were included in those two clinical trials I mentioned, there's robust evidence and ongoing real world and implementation science studies that really have about 4,000 people in those studies as well. So we have a breadth and depth of data on the use of Apretude in a diverse patient population.
Awesome. And what do those studies say about how effective long-acting injectable PrEP is compared to the daily pills?
Yeah, so in both studies, HPTN 083 and 084, Apretude, cabotegravir long-acting, was proven to be superior to both in both studies to the daily oral option. And so it was really kind of groundbreaking. In 083, we were really looking for, 083 looked at transgender women and men who have sex with men. And so in that study, we were looking for same. So kind of we wanted to make sure that it was non-inferior to the oral, and actually were quite surprised when we got the results to see that it actually showed superiority. And then in 084, because we had known for so long, which was a study for women and cisgender women, we knew for so long that that was an area that we needed some better traction with women taking PrEP. And so that study, 084, was solely cisgender women participating in that study. And so we were actually looking for superiority in that study. That was the endpoint that we were looking for. And we actually achieved superiority in that study as well. So both showed, again, in the 083 and 084 studies, that the long-acting cabotegravir was superior to the daily oral that was being studied.
Well, awesome. And so what's been the response so far from both patients and providers?
Yeah, I think the response has been great. Again, I think I've mentioned before, patient choice and people really hearing from the community, hearing from providers telling us that, we needed more options, we need more choices if we actually intend to get all the people who could benefit from PrEP on PrEP, because we're not a one size fits all as people. And so we need different options. And so we've seen strong interest in the long-acting PrEP and Apretude compared to daily orals. We do a lot of what we call PRO studies or PRO data to get that out, so patient-reported outcomes. And in those outcomes, we see many times, most of the time, that the people who report out, that they report having that preference for the long-acting injectable. And it's interesting because we talk about people who've been disproportionately impacted over time and people who had been slow to uptake PrEP, particularly when we think about populations of transgender women, cisgender women, MSM, and Black and Latinx communities. We've seen actually in those communities strong preference for the long-acting injectable over daily oral pills. And so again, kind of getting us to a place where we can reach some of those communities that haven't been reached before by having this new modality of a long-acting PrEP option like Apretude.
Well, that's great to hear that we're reaching more marginalized communities with the new injectables. And are there any new formulations or technologies on the horizons that we should be excited about?
So I think when we talk about what's on the horizon, I think all of us in the space, working in this space, and the researchers in the space, we're always looking for more options, more choices, because we know we're going to need that again to reach the communities that we want to serve. So I can, speak around kind of what I know we're doing at ViiV Healthcare for sure is looking at those longer duration. So can we extend beyond every 2 months? Can we do every 4 months? Can we get to twice a year dosing? That sort of thing. Can we choose something other than injectables? I know there's lots of studies around looking at rings, looking at implants. So there's so many different options. Can we do patches? Can we combine, long-acting prevention options for HIV? Can we combine those with oral contraceptives? So there's so many different things that we think about, and I love to always point out that we don't think about these in a vacuum or in a silo. As researchers, we pull in the community. So we have community advisory groups that join us on this journey early in the research and development stages to tell us really what direction we should be going in. Because, at ViiV, we feel like the patient voice is what should drive our innovation and should drive where we're going next. And so we make sure that they're lockstep with us along this journey to help us decide what the next phases should be and the next steps should be.
So looking ahead, what gives you hope when you think about the future of HIV prevention?
What gives me hope is that we'll get to a place where we have multiple options for everyone and something that will fit the needs of everyone. Because I think ultimately that is the only way that we'll get to a place where we can end the epidemic. And I think that's in the prevention space for me, but also for, in the treatment space. We need to make sure that we have these options for everyone because, again, we're not a monolith. We're not all the same. And we need something that works for us, right? And so for you, Danielle, the same thing that works for you doesn't work for me. And I need to make sure that there is something, and I say but I mean we as a company, as ViiV, but I also as a clinician take it very personal and to heart that I need to make sure that I'm doing everything that I can to make sure that everybody has something that works for them. Because the ultimate goal is to get us to a place where we can end the epidemic, where we see no new HIV infections or new HIV diagnoses every year. And so that's what I'm hopeful for, is that we will get to that place. I think we have the right tools, we have the right people in places that are making the hard decisions. We've pulled community in along the journey with us to have this conversation and help drive what that innovation and next steps looks like. And so I think that is something that I'm hopeful for, and I think we'll get there for sure.
If you could change one thing in the system to improve PrEP access or adherence, what would it be?
If I could change, you said one thing. Can I give two things?
Sure.
Okay. So I think the two things would be one, increasing awareness and education. I think that is like one of the things that we need to work on the most is because I think not everyone is aware always of these options, or aware of the opportunity, or aware that PrEP even exists. I know there's some data, I present quite often to folks that, even though PrEP has been around for as long as it has, only about 20 to 30% of cisgender women know that PrEP exists or even know what it is. So that is telling of the need for greater awareness and education. So that would be one. I think the second thing is to change the way we talk about HIV prevention, how we talk about HIV in general, how we have conversations about sexual health. And so, one of the things that I think about that we've done at ViiV Healthcare, particularly when we were looking at Black women, was this campaign or movement now around shifting the language from risk to reason. So instead of saying you're at risk for something, let's talk about the reasons that HIV prevention may be right for you, right? And we didn't do that again in a vacuum or in a silo by ourselves. We pulled together a Black women's working group to really help us unpack why is it that we see this low uptake of PrEP in Black women? Like, what drives that? And they clearly said to us it was the messaging. It doesn't feel good for someone to come and tell you that you're at risk for something, because risk really implies, that you're doing something wrong. It's shameful, right? And it places blame for a lot of folks on you as a person, that you did something wrong to put yourself at risk. And so shifting that language to say, hey, let's talk about like what's important to you. Let's talk about what reasons might be important for you to consider being in care, right, for HIV treatment, but also for folks what are the reasons that HIV prevention may be right for you, right? Tell me a little bit about yourself. Tell me what matters to you so that I can help identify what may be the reason or the factor that would be something that we would need to consider to make HIV prevention be something that you think is right for you. And so I think that's the other piece: reshifting, reframing the language that we use when we have conversations around sexual health and HIV prevention and care.
Wow. And what advice would you give to someone considering starting PrEP today?
I would say to have an open and honest conversation with who you can trust, right? So, it may be family members, right? It may be friends. And so being in a space where you can have open, honest dialogue around why prevention may be something that you're interested in and considering starting. And then I think being empowered to have that conversation with your provider, your healthcare provider, is something that's also going to be important. And equip yourself with as much knowledge as you can before you get to that appointment to have that conversation. Because the reality is, just as much as I say community often is not as aware of PrEP, sometimes that's the case for general practitioners, right? If you're not an HIV specialist, sometimes this isn't something that you're getting that education on. And so we also, as patients, as consumers, clients, need to be prepared when we go to have these conversations and feel empowered to do so, and ask for the things that we want and the things that we need. And I think feeling comfortable having sexual health conversations is going to be important, because that's what helps us drive that conversation and helps us drive us to the right choice for us in terms of what PrEP we want to use. And so it's really about taking some ownership here, I think, and being ready to have those conversations. And ask all the questions. Don't be shy, right? Because we want to know all the things, right? When we go in, we want to know, how am I taking it? So I make sure I take the medication correctly. What do the appointments look like? Coming in and having the appointments that I need and the labs that I'm going to get. I think asking about any side effects, right? Talking about what other medications you may or may not be on, or whether that be things that you get over the counter or whether it's prescribed by someone. I think we need to have that conversation. So I think it's just one, being open and honest about, your need for PrEP, why you want PrEP, and everything, the factors that make you who you are, being comfortable having that conversation so we can make sure that we choose the right option for PrEP.
Wow, that was such great advice. I think that's all of my questions. Was there anything else you wanted to add?
I don't think so at this point. I think it's been a great conversation, for sure. I've enjoyed having conversation with you. I hope this has been helpful for folks as well. I hope that people take away from the conversation that, PrEP one is for everybody. And so, whether you, you know, are someone who wants pills, whether you want someone who wants long acting injectables, there's an option for you and there's an option for everybody. And, we can do this. I think that's what I would want to leave people with. We can do this. We can end the HIV epidemic if we all play our part and we all, find what works for us. That's what I would leave us with.
Well, thank you so much for joining me today, Alftan. For any of our listeners in the Mobile, Alabama area, if you are interested in getting on PrEP, you are welcome to visit Shell Health, the on-site clinic at AIDS Alabama South, located at 4321 Downtowner Loop North in Mobile. Or you can always Google your local health department or PrEP near me to find a provider. Thank you, everyone, for listening. Yeah, have a good one. Bye-bye.